I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. Once again, bringing to you the stories of the people out there, particularly those individuals that are exceptional in their field in health optimizing from all types of disciplines, so that you get a good taste of all the things that matter to you. See, I don't know you personally, but I know that the problems out there need to be solved. And how do we actually do that on this particular podcast? And it's very, very different than the other podcasts. Other podcasts are practically, selling you something or, espousing themselves. The truth of the matter is that, that may be relevant for you, but how do you discern that? So that's the key. How do you determine what's right for you? So this podcast series is always about sharing with you the process by which expert individuals make decisions or help their patients make decisions as to what it is that they now need to do to resolve some sort of issue or problem that they have. And so what's exciting about this is that you get to witness yourself in this problem, and you might get a little triggered or you might be a little judgmental. Well, whatever weird feeling comes up, that's an indicator from inside of you that you need to pay attention. There's something here that matters that you're not necessarily liking that you need to do something about. And so how do we do that for today? Well, after I introduce or my guests introduce themselves, we will do about a 6 to 8 minute role play, after which, we will unpack. And the role play, let me be specific about the role play. One of them will present with a particular problem, and through dialogue, the other will guide them to some form of resolution. Now, clearly, 6 minutes is not a lot of time, but you'll get the idea of what it is that you can do. And then if you want more information, you can always reach out to these amazing human beings. And as we unpack, you will find some distinctions, some action steps that you can then take that will absolutely serve you. So it gives me great pleasure to once again be inviting back Paul Brewer. Thank you so much for coming here today, and Jeremy Schmoe. Paul, go ahead and introduce yourself just briefly. We'll go with Jeremy, and then we'll do the role play.
Great. So I'm a neuro-optometrist based out of Boise, Idaho. My basic, I guess, take home from what about me is that originally I'm from Hawaii, grew up in the ocean, love the water, great stuff. Worked with a lot of athletes, played a lot of sports in my life. Did sports in high school and college, and now I'm treating a lot of athletes, kind of with people that have concussions, or in addition to that, doing sports enhancement. So I work with a lot of athletes that want to have the edge against other athletes.
I love it. And such an important field for all of us, because really, quite frankly, the kind of work that you do is relevant to anybody who wants to optimize their health. And I love the fact that your focus is also on concussion, because it's a very serious condition that afflicts many, many people in many different ways. So I know you're amazing at that, Paul. Thank you. Jeremy.
All right. Yeah, my name is Dr. Jeremy Schmoe. I'm the founder and director of the Functional Neurology Center in Minnetonka, Minnesota. I'm a board certified chiropractic neurologist with training through a program called the Carrick Institute. I've been doing this for close to 15 years. And my main focus are patients with lingering post-concussion symptoms. So a lot of dizziness, dysautonomia, vertigo, imbalance, chronic headaches. But then we also see a lot of patients that come to see us that have a history of concussion, but they also want to perform better as well. So I work with a lot of hockey players, worked with close to 50 NHL players that have come to see me at our office. So we're all about just getting people's brains better.
And Jeremy, that's really very impressive. And thank you for that. What's not impressive is I missaid your name. I had that misspelled in my system here. So Dr. Schmoe, I apologize.
Yep.
But thank you for great. All right. So I know that Jeremy, you're going to present with a problem first.
Yep.
And then Paul will be the guide. And like I said, it's all raw, it's all unfiltered, and everything can happen. Go ahead.
Yeah. So, hi, Dr. Paul. So I'm coming to see you today. I played baseball in college, but I also had some, a few concussions when I was younger, skiing accidents. Even noticed when I was younger that I had some issues with my eye tracking, where maybe I felt a little bit slower than some of the other people playing video games. Tracking was kind of hard. And now, when I'm pitching, it just feels like there's a little bit of a change in the way that I perceive where I am in relationship to the catcher. My depth perception maybe feels a little bit off. But then I also have some issues with the background. Like if there's a lot of fans and people are moving around, it makes me feel a little bit unsteady with my eyes. So I was just coming to see you to see if there's anything that you could come up with to see if I have some problems with my eye movements or, anything going on with my brain.
Oh, totally. I understand exactly where you're coming from. When I played sports, growing up and in college, like I had an eye issue myself, and it's amazing how you can go so far. And again, I applaud you for getting this far, getting to the major leagues and pitching and whatnot. And it's great that you got that far and you had all these issues. And I know exactly where you're coming from because I felt the same way. I had these issues, but at least you identified that you have eye tracking issues.
Yeah.
When I was growing up and I was playing, I had no idea I had eye tracking issues. All I know is that my performance went up and down, up and down. There's some days I was spot on, and other days I just like, what's going on, And so today, what we'll do is we're going to actually do some tests to kind of see where you're at in each part of your vision. We're going to look at your eye tracking. We'll look at your eye focusing. We'll look at your eye teaming and see if they're normalized. And if they're not normalized, we'll get it where it should be. And then once we get to that point, we'll do some optimization exercises. And the cool thing about optimization is that in at least sports, it's kind of like I like to equate it to the movie Spider-Man. So everyone watched some version of Spider-Man, right? And in one part of the movie, you got Peter Parker in the school, and you got the other guy ready to punch him. And Peter Parker's already Spider-Man, has his senses, right? And he sees everything go in slow motion.
Okay.
My goal for you is to figuratively have you see things go in slow motion by the time we're finished optimizing your vision. And that when you do that, you're able to see a lot more and process a lot more when you're pitching in baseball.
Okay. Yeah, and one of the other things that I notice is like when I'm reading, sometimes I have to like close an eye or like switch back and forth between opening and closing an eye, and the tracking when I'm reading feels a little bit off, and I also had that, when I was younger, but I've only had an exam where people have just looked at my prescription. I've never had a more functional eye exam. So that's why I'm here.
Yeah, for sure. Yeah, we'll definitely look at all that. So a lot of times when you're closing one eye, when you're reading, a lot of times you'll see like you have kids, if they have issues like that, they'll kind of like read like this. So a lot of times when they're covering one eye, it's usually an eye teaming issue where the eyes aren't quite working together as a team. So there's a lot of tests we can do to kind of see if that's the issue or not.
Okay. Cool. Yeah. And one of the other things that I notice is that it seems like my posture seems to be off, but it seems somehow related to my eyes in some way.
For sure, yeah. So there's a lot of tests we can do to see how your vision is related to your postural system. So there's all these different systems like the vestibular system. That's like your kind of take on balance system. So what I'll do is I'll test the vision stuff, and if there's still issues with those connections, I know a really cool functional chiropractor up in Minnesota where you can actually go and see him, and he'll actually take care of a lot of that other stuff as well.
Cool. Thank
Excellent.
you.
Yeah.
Excellent, gentlemen. Love this. Let me start with you, Jeremy. Give us context. What was that all about for you?
Yeah. So, I mean, that was kind of me right there. So I played college baseball. I also had concussions when I was skiing when I was younger. And then I had like 3 back-to-back concussions. But I even noticed when I was little, when I was like 5 or 6, that when I was, playing video games and, doing things with my friends, that they were just faster. So I know that something happened when I was younger that probably affected my eye tracking. So like I've kind of been on this journey since I figured this stuff out to get, every single eye movement as good as it possibly can be. Yeah. And then I had some concussions. I also had exposure to, I had Lyme disease and I got babesia when I was in Costa Rica, got infected down there. And that really messed up my eye movements. tons of issues with convergence and like motion sensitivity, like visual motion sensitivity. The troubles with driving, as things were coming past me, everything just looked like it was way too fast. So it's almost like visually induced dizziness, visual vertigo. So that's, my whole thing with the stuff that I do now is really trying to understand those connections between the multisensory processing systems, between the visual, vestibular, proprioceptive, and how it all links together. But yeah, I truly believe that some of these eye issues affected my performance in sports in the way that I would just map out where my body is in space. And I think that it would lead to fatigue in my neurology and just come to a point where it actually changes your release point of the ball. It's almost like it fatigues your nervous system, and then your cerebellum, this area of the brain that's trying to hold everything together, just fatigues out. So I'd be like, all right, I'm doing really good, and I'm really strong. But then next thing you know, it's just, and everything falls apart.
Right.
So that's where I think that, people like Paul, looking at the visual vestibular integration and knowing everything about the neuro-optometrics of this can really enhance professional athletes, especially baseball pitchers, hitters as well. So that was the context behind it.
Yeah, that's an amazing story, and I applaud you to have the courage to, delve into what's really going on, recognizing, first of all, I think that's the key, and most people don't even know that. But who better to be able to guide others than someone like yourself who's already gone through this and understands at a granular level the nuances that otherwise you wouldn't, right?
Yeah.
And I think that's a big challenge or limitation, I should say, for most practitioners, and a super advantage from you. So I think that's amazing. Paul, give us context. What was that all about for you?
That actually blew my mind away because his story is so similar to mine. I was like, when he was saying that, I'm like, oh my gosh, he's telling my story. I mean, minus the line part. But again, I grew up and I was like an extreme athlete. I surfed, I jumped off cliffs, I did all kinds of silly stuff, fun stuff at the time, but now I look back at it, silly stuff. Where I had concussions, and back then the doctor just said, "Hey, just rest, you're fine, do whatever." And so I had these lingering issues, just like Jeremy had, where my eye tracking was off. And so I have days where I was on fire and other days where I'm like, again, what's going on? Right. And so that to me is really important for people to know that there are stuff you can do once in the process of recovering where you can actually enhance your vision. It's super important. The vision, vestibular, proprioceptive systems, they're so intimately integrated that a lot of times we overlook the other two when we're treating one. So I guess even to other eye doctors too, where like, they might just be doing vision training when they should be looking at how it's integrated with the other systems. And a lot of times, and I see this at Jeremy's place, where you start working on the vestibular system and it helps the vision, or if you work on the vision, it helps the vestibular. So they kind of work together.
Yeah.
You guys are really impressive on so many different levels, basically with your own personal background of experience, but also your personal background of training is also giving you some very, very unique skill sets and insights that most others wouldn't have. And I love the fact that what you're doing is you're actually unifying, you're integrating so many aspects of what it is that's, contributing to it, when most people would just focus on one thing, just like you said, Paul. So I think that's quite remarkable. Now what I like to do is, give the mic back to both of you with any more insights and distinctions. And at the end, before we wrap it up, I want to talk about your Lyme's disease for a moment.
Yeah.
But let's start off with Jeremy. What else is relevant for people to know? And let me just add this particular item is that, and I guess you would attest to this, is that concussion is a very much unrecognized issue. Fortunately, with the media attention lately, there's more. But once again, I mean, doctors are simply not educated enough to recognize it. And then the people, the individuals don't recognize that, this is really as a result of a concussion. They might think it's something else. And so that's why this story is so relevant, because people can witness and recognize themselves like, oh, I got that problem, or realize that it's someone else. And I would imagine oftentimes, what people would be told, they would be told, well, it's just in your head.
Yeah. Yeah, so I mean, I really think that in terms of interprofessional communication, like a lot of different, there's a lot of smaller groups within individual professions that are really actually starting to take concussion to the next level. So you have, you have the chiropractors that are doing functional neurology that are really using some advanced technologies to help people with concussion. But then you also have like the doctors of physical therapy and the DPTs with advanced training in neurology that are really amazing at the vestibular aspect of things as well. And then you have the optometrist, but underneath that, you have the neuro-optometrist that are very specialized. So it's like with underneath each profession are these specialized groups. The problem is there's not too many of all of those individuals. All right. So what, my hopes for the future are that these smaller groups within the professions just train thousands of people under, every single profession. And then eventually everything unifies and everybody has a good general idea of what's happening from a concussion aspect. So if you go see a primary care optometrist, they've had some training by somebody like Paul where they could recognize it and then refer. All right. So that I really think that things are moving in the right direction in terms of education, but there's not one single, all right, here's Concussion University. And people go to Concussion University and get all the training. It's all postgraduate training. So, I really think things are moving in the way that it needs to. And in terms of the rehabilitation that people are doing, it's just next level. Um, there's new lab tests that can identify concussion through saliva and then blood to show if maybe this person's going to have a lingering concussion, but that's not being used at the bedside, at the field to the level of what it should be. So things are coming down the pipeline. There's a lot of amazing technology in terms of eye tracking that can be utilized. And then I think the future of the eye tracking is having virtual reality devices on the court, on the side, you pop somebody out, you graph their eyes out in virtual reality. And then the future will probably be artificial intelligence technology where it just says, all right, boom, your saccades were slow in this direction, the pursuits have intrusions, and then it flags that person as being dysfunctional based off of data that's been collected by a large amount of people. So I really think that's where it's going. And then in terms of the rehab, lots of advanced visual vestibular training that's happening out there. People are really paying attention to what's happening with the cervical spine at this point. Where before people were like, oh, it's concussion, but then they would miss the fact that there's stuff going on with the neck. And then there's a lot of research that's coming out about the changes with concussion of how it affects your autonomic nervous system, heart rate variability, vagal tone. So people are identifying that and developing very specific exercise protocols to get people back. So, I think people are starting to take a look at the research. It's starting to trickle down clinically, and people are realizing that, there can be other things that are going on with that individual prior to them getting the concussion. What if they had strabismus when they were younger, Paul? Or what if they already had eye tracking issues or convergence insufficiency? Or what if they've been living in a moldy house and they had Lyme disease, or they had a gut infection, or they were anemic? Or what if they had major hormonal changes even prior to getting this head injury? And then it kicks you into this metabolic web of dysfunction. So, there's so much research out there, but it's trying to just like take it all and put it all together and come up with very specific clinical systems that each individual provider can do their part. So, I think the key thing is to realize that there's actually people like Paul out there that are very precise with the way that they look at the eyes. And there's people like me that are very precise with the way that we look at the vestibular neck autonomic integration as well as eye movement. So
Yeah, I love
Yeah.
everything that you're saying. And you're actually speaking my jam, which gives me permission to actually share something pretty cool with you guys.
Yeah.
Because again, it's about unifying everything. And I think the challenge is that too often the approach is so myopic, so limited. And so they may address one thing, but because of all the other issues going on, as you both have mentioned, you're not going to get any kind of resolution, or the resolution is very, very limited. And
Yeah.
even before we get AI, by the way, there's technology that I now have access to that actually will answer all those questions that you just kind of offered, by the way, in a matter of 10 minutes without any need for saliva or blood or any x-ray. It's
Cool.
quite remarkable, and it's the new technology that's coming out in the form of frequency technology, frequency medicine, where it's sort of like the same thing that happens on CSI with spectroscopy. They shoot in all these different frequencies to actually identify molecules and proteins in tissues. We can do the same thing with the body right now, and so all those things that you just shared levels you up tenfold in your ability to address what needs to happen, and then ultimately actually bring in other collaborators like Paul to then very specifically address other things, because ultimately, in what I call this unified model, it's way beyond just functional integrated, is where we actually all work together, right?
Yeah.
Because you have
Cool.
these unique skill sets, right? And especially the structural part, which I think many people do forget. But you just said it. I mean, when you have a concussion, well, it's probably something going on the neck, and probably something else going on, and then something else elsewhere going on. Paul,
Yeah.
what say you?
Yeah, for sure. So like, Jeremy brought up a lot of good points, and just, the last couple, 3 years, I'm actually on an executive board for, it's called an International Sports Vision Association. And that association is basically worldwide, and it takes any profession that wants to come in. And the whole point of that profession is it's more sports related, but to teach about the visual system in sports and how you can rehab it and optimize it. So we talk a lot about this kind of stuff. How do we get more collaboration between other professions? How do we work better together? How can we teach other professions to do some of the stuff we do so they have more tools at their disposal to help people they're working with? And just recently, I actually just got invited to be in it's called the Neuro Huddle, which is it's a cool like organization. So the whole point of Neuro Huddle is like kind of like teaching football players how to tackle better, how to reduce the incidence of concussions. And so I'm on this committee where we're planning this, conference in Hawaii, which is kind of cool. So I'm going to go in Hawaii next January, which is awesome. But the whole point of that is to bring more education to the general population, to athletic trainers, to coaches, so they have more tools at their disposal so they can help their athletes out as well. So that's the cool thing, is that I think we are going in the right direction. There's so much technology out there. There's a lot more people that are more in tune to what's happening with people that have concussions. So we're really going to help each other. I'm like super excited to work with all these professions. I have, colleagues in medical school and dental. I mean, all these professions that do all these different things, and we're working together. And it's just awesome to see the progress in patients and seeing that they get a smile on their face again.
Yeah, and that's what it's all about. And not that I can claim that I'm as an extreme athlete as you guys were, but fun fact was, I did play rugby for about 7 years. I was the winger. Sometimes they wanted to make me the hooker, but I decided not to do that. And if anybody understands rugby, they know what the hooker does. But most importantly, because I was small and agile, I actually never got a concussion. So I feel very fortunate. And then I went to something a little more safe, and that was rowing. We need to wrap it up. This conversation is so critically important for all those out there. I really hope that people who are listening to this reach out to you as they recognize that they have some of these issues, some of these symptoms, or know someone that they care about has some of these symptoms. So, Jeremy, with starting off with you,
Yeah.
any final words, and how do people get a hold of you?
Yeah, I mean, so you can get a hold of me. My website, it's thefnc.com. And I also lecture for a program called the Carrick Institute. And coming up in, I think it's June, I have a course that's all on visual vestibular integration and concussion, dizziness, vertigo. But we're really going in depth on vertical eye movements and torsional eye movements, which is pretty cool because a lot of the, vestibular rehab that's out there focuses on yaw plane and pitch plane, but we're going to be talking about like translation and roll pathways. And those are some of the more complex situations where, people with lingering post-concussion symptoms usually have problems in the upper brainstem, in the midbrain. So we're mostly talking about vertical and torsional eye movements. Now you can rehab that through multi-sensory integration. But yeah, the website's the fnc.com. Clinic's called the Functional Neurology Center, and we're in Minnetonka, Minnesota.
Right, that is awesome. Thank you for that. Paul.
Yeah, you can reach me. My website's Diverge Neurovision. If you go on there, you can contact me on there. I'm on Instagram, Facebook. Based in Boise, Idaho, but I also fly out and do different like seminars. In addition, I also work for the Carrick Institute as well. I do more of the visual courses there, and I've taken Jeremy's course too. Phenomenal! Like I learned a ton in his course. It was awesome.
I think we can all learn a ton from you guys. You guys are spectacular. But final words from you, Paul. Anything else you want to say?
Yeah, so honestly, like sports performance, I mean, that's my take home is that like you can always do more. You know, if you want to improve your sports, you can literally improve. There's no ceiling cap on that. A lot of people think that, you know, once I hit the top, I can't progress anymore. There's always something you can improve.
Totally.
Well, you guys are truly amazing pioneers in your field. I can imagine that how distressing it is for people with these kinds of symptoms, because it's sort of like, you know, what do I do? How do I manage this? Is this something in my head? You know, whatever. Fortunately, I've never experienced that. But and nowadays, I mean, it's clearly a big problem. And thank you for what it is that you do. Well, wrapping it up, my name is Dr. Bart Rademaker, and this is the Doctor's Guide podcast, raw and unfiltered. And once again, bringing you gems of insights and incredible stories of perseverance and courage, so that they are the models and examples that you can follow, so that you can, you know, go on that journey to make, you know, better decisions for yourself or for someone else to optimize you. Thank you, and we will be back.